The House Oversight Committee will come to order. Will the clerk please take attendance?
Chair Johnson.
Here.
Representatives Altman.
Here.
Hoytinga.
Here.
Riley.
Here.
O'Malley.
Here.
Wozniak.
Here.
Brixey.
Here.
LeGrand. Young.
Here.
Mr. Chair, you do have a quorum.
All right. Representative Altman moves to adopt the minutes from the January 28, 2021 committee meeting. Without objection, the minutes are approved. At this time, we'll take up House Resolution 23 by Rep. Beeson. If you could come up and testify. Normally, my general rule of thumb is testimony one week, voting the next week. Even though this resolution wasn't before us last week, we did do testimony on the issue before us. So we're going to go ahead and have testimony, and if the votes are there, we will vote that out. So with that, I will give the floor to Rep. Beeson.
Thank you, Chair Johnson. Okay. Today, I'm here to ask for your support and adopt House Resolution 23. This resolution urges the governor and the Michigan Department of Health and Human Services to lift the ban on certain high school sports and allow play to resume immediately. COVID has disrupted the lives of people in Michigan and across the world. School closure, in particular, have had devastating impacts on students. They are struggling with academic challenges and the lack of social and emotional benefits provided by sports and in classes. The simple truth is state government should be helping our children through the situation, not making it worse. The chaos of the pandemic has been hard on everyone, but especially the kids in Michigan. Most recently, winter sports like wrestling, competitive cheer, and boys and girls basketball were suspended and won't be able to play for a month. There is very little data available defending the suspension of our youth sports, but we have heard stories after stories about the way it's hurting our kids. Every one of us here and reps heard from our family, our friends, and neighbors about this issue. Parents are forced to watch their children suffer serious harm while government mandates create chaos in their young lives. They are seeing grades slip, kids suffering from isolation, and far too many signs of depression and other mental health struggles. Our children, my children, deserve better than this. Again, I urge the governor and the DHHS to put a stop to this ban and allow kids to get back in the game. I urge all of you to support this resolution, and thank you very much.
All right. Are there any questions? Representative LeGrand.
Thank you, Mr. Chair. We had some really good discussion about this week, and Representative, you and I had some discussion on this. You know, there's a real tension here because we really do want these athletes to be able to compete, and we really want them to be able to do it safely. You certainly are in favor of us having all appropriate safeguards in place for testing and you know, whatever we can do here, correct?
Correct.
Have you thought about the possibility of prioritizing athletes for receiving vaccines? Because that might really help us move in the right direction here.
I haven't really got into the part because of their age and everything that I've read about it because a lot of these athletes are 16 and under, because my daughter is only 15 and I'm not willing to do that yet. Maybe you have kids too? So I don't want to risk the chance yet for our young athletes. But if we can do a COVID test at 99.8%, which I would love that kind of return on my money, safety issues, like we've done that with the Michigan Health or Michigan High School Association. Like if they have a safe way to do it, we should be doing it.
My other question is this. Events have sort of overtaken us here. I mean, you probably saw in the news this morning, the governor is about to announce that she's going to do exactly what you're asking. You know that, right? So in like 3 hours, she's going to have a press conference on this issue?
And Rep. LeGrand, I heard about this, right? But in my business, like, you got to make sure that we are, I don't believe hearsay. I like to see it with my own eyes. I'm not here to wait for the wrong person to say it's going to happen, and it doesn't happen, just like we did in our restaurants. We're going to open and we're not going to open and we're just going to continue down that. We need to make sure that we're out in front of this.
So I guess my question is, would you be open to simply delaying this resolution a week, since I think in 3 hours this is going to be moot?
No, I'm not.
Okay, thanks.
Yes.
And to that point, last week Thursday we were told, hey, I think governor's going to open things up. Last week Friday, same thing. Saturday, the same thing. Eventually, we got to move ahead and just go forward. Representative Brixey has a question.
Thank you, Mr. Chair. Representative, what do you think we need to be doing as a state to ensure that the youth sports, especially those that are indoors, are done in a safe manner? The fall sports were all outside, and this is our first experience with indoor sports.
So some of the stuff that we did back in Bay County was, even when the fall sports were in place, we actually listed the site where they were being streamed, and we watched a lot of them from our phones at our house, which was amazing. And I'm fine with whatever the MHSA comes up with to make it safe.
So but your resolution doesn't address that.
No, this resolution is to get it back open.
Okay, but it doesn't express how to do it in a safe manner.
Correct.
Okay.
All right, and just to clarify, not all fall sports were outside. Actually, a lot of them are still inside. All right, so I don't see any further questions. Representative Brixey, are you offering this amendment?
Yes, I am.
Would you like to speak to it, please?
Yes, I would. Thank you, Mr. Chair. My amendment would add a whereas clause stating that the legislature should immediately release all of the federal COVID-19 relief funding. Our schools really need this funding to implement their plans to safely reopen classrooms and, importantly, to fund the testing and other costs that will be incurred by resuming the sports. The governor will be lifting some of the guidelines to allow winter sports to resume and already called for the schools to reopen back in January. So right now, the only thing preventing all of that is the release of the full federal funding. So our districts have the resources they need to fund testing, testing, tracing, and everything else involved with reopening and resuming sports safely. And of course, I don't want to see Michigan become a donor state in regards to federal COVID funding. Therefore, I move my amendment.
All right, thank you, Representative. And good news for you, we are actually going to vote out some appropriations bills today, so I think you're going to be happy with that. I don't think that's necessary to be part of this, so I will be voting no. Madam Clerk, can we take the roll call vote on the amendment?
On the motion to adopt the amendment, Chair Johnson,
No.
Representatives Altman,
No.
Whittinga,
No.
Riley,
No.
O'Malley,
No.
Wozniak,
No.
Brixey,
Yes.
LeGrand,
Yes.
Young.
Yes.
Mr. Chair, you have 3 yeas, 6 nays, and no pass. With that, the amendment is not adopted.
All right, seeing no other amendments, would someone want to make the motion to report House Resolution 23? Representative O'Malley makes the motion. Madam Clerk, can you take the roll call vote?
On the motion to report the resolution, Chair Johnson,
Yes.
Representatives Altman,
Yes.
Whittinga,
Yes.
Riley,
Yes.
O'Malley,
Yes.
Wozniak,
Yeah.
Brixey,
No.
LeGrand,
No.
Young.
No.
Mr. Chair, you have 6 yeas, 3 nays, and no pass. With that, the resolution is reported with recommendation.
Thank you. All right, thanks for being here, Rep.
Thank you.
All right, at this point in time, is Director Hertel on the line? Do we know? Okay, so I think we're going to go ahead and do a presentation on the vaccine rollout. Obviously, there's been a number of issues starting out early on. There's some supply issues from the federal government. Some of those have been kind of worked out. And so we want to bring the director in today, kind of talk about how they've shifted their response to meet those, how they're deciding where the vaccines go. We're a big state, a lot of counties to get them to, and try to figure out who gets what when. So with that, I will turn it over to Director Hertel, and thank you for being here this morning.
Thank you, Chair Johnson, and thank you, members of the committee, for inviting me today to share our vaccine strategy with you. Before I get started, I do feel like I just need to give a little caveat. My son is still in virtual schooling, and so I hope that there won't be any disruptions, but sometimes I hear things crash or spill, and so I apologize in advance if that should occur. I brought some materials that I think Emily Schwarzkopf, who's with me today, will be sharing on the screen so that you have you can follow along with the detail that we are providing in this vaccine strategy. And you can also find this information on our website. Last Friday, the Governor's Protect Michigan Commission kicked off in its first meeting, and we were able to unveil this vaccination strategy at that time. I'd like to thank Dr. Jonay Caldoun and her great team in public health and others in the department and across state government for putting this presentation together. She does a really fantastic job of presenting, and this will only be my second time, so I apologize that I may not be as on top of it as she is. Next slide, Emily. So as we work to implement this strategy on vaccinations, we are following some guiding principles to help us stay true to meeting the goals that we have. And primarily, we'd like to ensure that all Michiganders have equitable access to vaccines. We want to ensure that our vaccine planning and distribution is inclusive, that we are using data to continue to make decisions and track our progress, and that we are using our resources in an effective way to continue implementing this strategy. Finally, we want to make sure that we are communicating and educating the public and all of our stakeholders in a very transparent and accurate way. Next slide. Our goal is to ensure that 70% of Michiganders aged 16 and up who are eligible to receive the vaccine are vaccinated as quickly as possible, that 90% of the doses delivered are administered within 7 days of arrival. And because we are currently utilizing 2 vaccines that require 2 shots, that 95% of people are getting their second dose of the vaccine within the expected time frame. We are also striving to achieve zero disparities across racial and ethnic groups. And our goal is that no Michigander should have to drive more than 20 minutes to reach a vaccination site. We are incorporating the Social Vulnerability Index that is published by the CDC to help guide us in ensuring that we're meeting these goals. The Social Vulnerability Index relies on 15 factors to help us identify areas of the state that may be more vulnerable to increased transmission and more severe symptoms of COVID-19. The status of the Michigan communities identified in the Social Vulnerability Index correlates with those communities that have been hardest hit by COVID-19 in Michigan. Our current vaccination our allocation strategy, we've started utilizing over the past few weeks to ensure that those providers who are receiving a vaccine have some uniformity in the vaccines that they are receiving and understand what they can be expecting. We have a flexible allocation that we are utilizing to dedicate to special populations, in particular, in the short term, those communities of color that have been hardest hit or are most vulnerable to COVID-19 transmission. We are also working to, again, allocate equitably across our hospitals and local health departments using the 1B populations encompassed in each of those regions. Our local health department baseline population on 65 years and older and other essential health line workers, those are the populations currently included in the 1B priority, is utilized in the formula for our local health department allocations. And with our hospitals, we are looking at percent of inpatient visits for individuals 65 and older from 2019. Again, we are incorporating the Social Vulnerability Index into the formula to weight those areas geographically when necessary. And then we are dividing the vaccine by type. So the Moderna or the Pfizer are currently the 2 vaccines that we are utilizing. We are also asking our partners to develop strategies to target their outreach with zip codes that have at least one high risk census tract. So this is a sample of what that means, either by the Social Vulnerability Index and then inclusive of additional chronic conditions that may make individuals more vulnerable to severe cases of COVID-19 and looking at that by zip code. This map shows where we have completed and planned vaccination clinics with our local health department partners, some of which have received the assistance of our National Guard partners, some of which have not. The shading on this map is indicative of those areas with a higher social vulnerability index, so you can see how that looks geographically across the state. And as you can see, and if you have a chance to look more carefully at this map after this committee or in the future, we have been able to stand up a number of clinics across the state that have been extremely successful in ensuring that individuals are able to get vaccinated. These are additional clinics across the state that have not been stood up by the local health departments, and give you an idea of the number of partners that we have across the state of Michigan who are able and willing to administer the vaccine to Michiganders. This is currently the schedule that we are planning on for getting the population in Michigan vaccinated based on the allocations that we have had coming into the state since the beginning of the year, approximately. So if those allocation numbers remain fairly static, this is how long it will take us to vaccinate all of the eligible individuals in the state. So we are looking out at a completion of the end of the year, but of course, this schedule is certainly subject to change. I am hopeful that it will change and that we will start receiving in the next couple of months more doses of each vaccine, and that potentially we could see an additional vaccine approved by the federal government for administration as well. So the strategies that we are working in order to make this plan a reality is that we want to first and foremost get more people vaccinated. We want to expand our capacity as much as possible, and in doing so, ensure that we are prioritizing those who are most vulnerable, which that social vulnerability index is helping us to identify, and ensuring that we are being equitable throughout this process. The goal here is that when we have enough vaccine for every eligible individual to receive the vaccine, that we have as many access points across the state for people to be able to get that vaccine as needed. We are working to build a broad network of vaccination sites, again, ensuring that Michiganders have access in conjunction with a number of partners, our local health departments and our National Guard partners, first and foremost, who were very successful in working their partnership at the second half of 2020 in standing up fantastic testing infrastructure across the state, and now being able to utilize that partnership and that infrastructure and transition that over to vaccine allocation and distribution across the state, as well as partnering with our more traditional providers through pharmacies, our FQHCs, and then looking at some of the neighborhood testing sites that we were able to establish last year, which provide greater access in areas that may not have some of those more traditional providers. We'll also work to target some harder to reach populations, primarily those who are homeless and very transient, disabled, and people who are homebound. We are also looking at innovative ways to reach people where they are by looking at non-traditional locations for vaccine administration, like nail salons, barbershops, being able to take advantage of rideshare programs and other public transportation to make sure that people can reach a vaccination site, incorporating public health in the emergency department so that when people are coming in, they have the opportunity to receive a vaccination while they are there. And then again, focusing on those primary care relationships with our primary care clinics and our FQHCs across the state. We are striving to promote efficiency in both our delivery and our administration by trying to maximize the allocation that we are receiving and driving some of that toward eliminating the disparities in vaccine administration. So currently working on, in partnership with the Protect Michigan Commission and other external partners, to promote frequent communication and education opportunities, engaging our stakeholders in the development of our allocation and distribution process, and also being responsive to feedback and challenges that our providers and partners are experiencing when it comes to our vaccine delivery and administration. We continue to work closely with the Biden administration to request the maximum amount that we can get of vaccine into the state of Michigan, and ensuring that we are channeling those vaccines to the most appropriate and vulnerable areas and populations to increase the speed with which we are being able to vaccinate. Obviously, this is a big task given the 3 strategies that I have gone over. And so we continue to look at how we can maximize our vaccination efforts through personnel across the state, significantly working with our National Guard partners who have been an invaluable piece of this COVID-19 response from the beginning, and also identifying other providers who are able to reach the populations that we are looking at and be able to provide those vaccines. So we have community vaccinators. EMS is an important partner as we look into how we're reaching people. We continue to leverage our volunteer registry to identify individuals who are interested in helping in these areas, and then working with as much as possible with other community members and partners to make sure that we are taking full advantage of the personnel networks that they have in place locally. And finally, I think one of the most important pieces of this strategy is making sure that we are empowering people with accurate information and making sure that they are confident in getting the vaccine. Educating individuals on the efficacy of the vaccine, given that how rapid bringing these vaccines to market occurred, is essential in ensuring that people trust the fact that they will be safe and that the vaccine is safe, and that we can encourage as many people to get vaccinated as possible. We will work very closely with community health workers to address some of the vaccine hesitancy that is experienced in some populations, and targeting our communications to celebrate and focus on the success stories that we see across the state when people are able to access the vaccine and feel such a rush of confidence and I think relief in many instances when they are finally able to get that first or second shot. So that is a lot of information to try to cover in a fairly short amount of time, and I'm sure that you all have a lot of questions. I'm not sure how much time, Chair, you've allotted for me in this presentation, but I'm able to take as many questions as you have, and anything that we cannot address during our time, I welcome the opportunity to follow up with any and all of you after this presentation. And I just want to thank you again for giving us this opportunity to come in and explain to you the steps that we are taking to ensure that we are vaccinating Michiganders in a safe and effective way.
Well,
thank you.
Well, thank you for the presentation and for being here. I think the first, from a procedural standpoint, can you run us through your communications with the federal government? When do you hear from them the number of vaccines you're going to receive? How long does it take from receiving that information to you guys determining where the vaccines are going, how many, and when does that information get to the local health departments, the hospital systems? When do they know how many they're going to get, and when do they actually get the vaccines? I know there's a lot of questions here, but basically I'm trying to figure out the vaccine coming from the feds. When do you guys know how many? When do the locals know how many? When do you actually get it? When do they actually get it?
Yes, that's a great question. And that has been, the process has been evolving over the last few weeks. So when we began, the state would learn from the federal government on Thursday what the expected allocation number was for the state for the following week. We would place orders or requests, the state would place the request orders with the CDC. Then by, I think it was Friday at noon was the deadline. The CDC would then place those orders with the manufacturer, and then the manufacturer would provide notification to the providers who were receiving the vaccine, and the vaccine would be delivered the following week. Sometimes early in the week, sometimes not. And so we were finding that out on a weekly basis. Thursday, we would know what was coming in for the following week, which did not give, obviously, us or others a lot of time to plan. Over the past few weeks, that process is being refined so that we are learning earlier in the week how much we will have coming into the state, and we are learning how much we will have coming into the state for 3 weeks into the future, to allow us to do more of that planning. 3 weeks ago, I think it was, we were able to finalize our allocation formula to be able to let the providers, the local health departments, and the hospitals who were receiving the vaccine know how much they would be getting for the following week. So it was still coming very late in the week, Fridays, but now we are going to be able to provide them some uniformity 3 weeks in advance so they know what to plan for. So that process is still evolving.
Good. Thank you.
But getting
for that.
better.
Thank you. Representative O'Malley.
Thank you very much, Mr. Chair. Thank you for your testimony today, and I'll just a personal comment here, having sat through dozens of COVID oversight committees. This was probably the clearest and most direct report I've heard from your department, so I appreciate for that clarity. Thank you.
Thank you.
Just a couple questions. One, talking to the boots on the ground folks in my district, I'm curious. I love doctor speak. It was referred to as the second shot, the side effects. Since it's a rather robust immune response to the second dose, it took me a second to figure out what that meant. Are you seeing any issues with people who might be getting the first dose but scared away from the second?
That's a good question. I have not heard anything like that, actually, but I can ask. Nobody has raised that with me yet.
Okay, just as word gets around, they're worried about that. The other question, and there's a way to sign up online, but I've heard that because some folks are not technologically able, et cetera, there's now a phone line. But I understand that when they call the phone line, they can't get through, it's disconnected, it rings. So are you aware of those issues, and how might you be proceeding?
Yes, we are aware of those issues, and we are trying to create as many avenues into the scheduling process as is feasible. So we know that I think everybody has some sort of online platform that they are using for scheduling. They will have some sort of direct phone number that they will be using for scheduling. And we are also able to use 211 for individuals to call to help get assistance on scheduling. So we continue to try to expand the number of access points, but right now, from a statewide perspective, 211 is uniform across the state.
Okay. Just a couple more questions, Mr. Chair. One of the things I've heard from some of the locals is my district has a lot of vacation homes. And what they're seeing is that some of the older folks are just staying put in those second homes, and they're hoping and worried that maybe when you're allocating doses that you might not compensate for those folks who, if you will, are off the radar. How do you watch out for those folks? How do you assess that, this area should get, X amount of doses, but we know we've got a few folks hiding in the bushes, so that they're not underdosed?
That's a good question, and that is a question that we have discussed and talked about. At this point, given the limited allocation that is coming into the state, we are utilizing that census population data, which may not account for some of those individuals who are living in second homes that is not a primary residence. But we will continue to work with those areas who may have a larger population of vacation home residents to ensure that we are able to cover that as we move into the future. Again, the hope is that we get to a point, and I believe that we will, I don't want to say soon because that's very subjective, but I know that we are headed there, where these issues will become non-issues because we will have so many doses available that people will be able to receive them regardless of their geographic location.
And of the million or so doses that have been given, can you give us a breakdown as how many of those are first doses and how many of them are second doses?
Yes, I can. If you could just give me a moment. We do have all of our data online on our michigan.gov website. My computer is being a little bit slow, so I may have to get back to that one as it loads, but I certainly can give that breakdown, and perhaps we could just send that to the committee after, if that's okay.
Sure. And one last quick question, and then I know there's others have questions. Just curious, this type of vaccine rollout is important, getting the word out to people. So what is maybe the biggest misconception that you are hearing from the public about this effort, if there is one?
Yeah, I think the greatest misconception about the effort is that the state have a warehouse where we are keeping vaccines. And in fact, the state never actually receives any vaccine. The vaccine goes directly from the manufacturer to the provider. We help facilitate the ordering process.
Thank you, Mr. Chair.
Yeah, I want to touch on one thing you said about the second dose. So on slide 3, you had a 95% goal of people getting their second dose within the right time frame. Where are we right now within that percentage? And what is that time frame? What happens if you miss it? Is that first shot completely useless then? And then I have a piggyback off that, but I'll let you answer that first.
Yeah, that's a good question that I'm not going to be able to answer in detail because we are still learning some of those things. And I am a little ashamed to admit that I can't remember which is which. One is 3 weeks after, one is 4 weeks after. But there is a little bit of time. We know that it doesn't have to be exactly, to the day, 4 or 3 weeks after. I would have to look again, and I will pull all of this data and have Emily send it to you on the exact percentages on second doses. But right now, to the best of my knowledge, we are on track for people receiving those second doses in a timely manner.
And if they don't receive it in a timely manner, is that first shot pointless then, or is there still some value?
No. Yes. The first shot is not pointless. The first shot will still give you some level of protection against COVID-19. It just will not be as much as getting both doses. So if the Pfizer vaccine is around 90 to 93% effective, the first shot will give you maybe 60% efficacy, but getting the second dose is really what will get you up to that full efficacy level.
So let's say 1 week you send to Allegan County 5,000 first doses, and it's a 3-week time frame. Do you guys make sure that they get 3 weeks later another 5,000 so that they get that second dose? I mean, what's the strategy there? Because I'd hate for us to have a lot of first doses, and then all of a sudden we don't have enough vaccines for that second one. I mean, how do you guys
Yeah.
compensate for that?
So the second dose ordering process is based on the number of first doses that were delivered 3 weeks prior or 4 weeks prior, depending on which vaccine is coming. So from an ordering and distribution perspective, it's an automatic number. They match up. I think we are working with our providers to ensure that they are maximizing the number of doses that they get for first doses, and ensuring that they are accounting for the second dose allocation as well, and making sure that those are being accounted for separately. So we continue to work through those challenges. Every time, again, when somebody raises a concern to us about these things, we work through it as quickly as possibly to ensure that we are meeting that goal of second dose timeliness.
Okay, thank you. Representative LeGrand.
Thank you, Mr. Chair. So I hate to be grumpy, but the first thing I noticed here is that I think it was your slide that sort of got vague at the end about vaccine rollout. Looks sort of to me like a train wreck. Now, I guess I have two questions. First of all, right now, what is the limiting factor on the speed of vaccine rollout? Is it availability of dosage, or is it infrastructure for actually administering the vaccine? So if the pinch point is the vaccine, there's not a lot we can do about that. If the pinch point is capacity to roll it out, then and I'm going to give you both questions at the same time. The second question then is, you said, gee, we hope to get the whole population done by the end of the year. It seems pretty clear that it's reasonable to assume that antibodies from either getting COVID or getting the vaccine only last about a year. So if our program hopes to get the state vaccinated by the end of the year, we're just going to have to start this process all over again. And if that's the case, then are you right now building essentially permanent mechanisms to be able to administer vaccines for the entire population annually that are sustainable? Because it's great to use the National Guard if you've got an emergency, but if we're building a system that's going to essentially not even get us to the end of vaccination before people start needing to get revaccinated, we might be bumping 20-year-olds 5 months from now because we have to revaccinate 75-year-olds. And if that's true, then we're talking about the need for a permanent structure that's scaled to be able to administer vaccines across the entire state to the whole population. So if you could speak to first the pinch point problem, where is our limiting factor? And second, what steps are you doing to put permanent, sustainable delivery systems in place?
Those are both excellent questions. Thank you. To answer the first question, we do have the infrastructure in place to be able to administer vaccines in a rapid, efficient fashion. The pressure point right now, the barrier, is the actual number of vaccines that we have to administer. And again, we are working very closely with the Biden administration and the CDC to, as every other state is as well, to coordinate the increase of the vaccines that are coming into each state for administration. To your second question, that's a great question. We are working as rapidly as we can right now with what we have to vaccinate as many people as possible, because we are starting to see some of the variants to COVID-19. And so we want to make sure that people are getting vaccinated as rapidly as possible to slow the transmission, which then slows the genetic mutation, resulting in fewer variants. But at some point, as we work through that, this initial response vaccination stage, receiving a COVID-19 vaccine will look like receiving a flu vaccine. So for me personally, I go to the Rite Aid down the street every year, and I get my COVID or my flu vaccine. My children go see their pediatrician, they get their flu vaccine. So when the vaccine, the COVID-19 vaccines are being manufactured and distributed in the quantities that we're looking for, we will be providing access in all of those traditional access points that you would be receiving a flu vaccine. And so we would continue on that process just like we do every year with the flu vaccine, which I hope you will have all gotten already as well. Sorry for that plug.
So one follow-up question. You are closer to this whole conversation than we are. What can you tell us about ramp up of availability of the vaccine? I mean, I would hope at some point we're building more capacity to roll these things out faster, like Pfizer's going to open some new facilities, Moderna's going to build some new labs, something. Is there anything you can tell us about the scaling up of vaccine production, what you're hearing on that topic?
I honestly could not comment on that. I don't know. That doesn't mean that nobody knows. It just means that I don't know. I've been focusing my time the past couple of weeks on some other items, including the continued creation of our vaccine distribution infrastructure.
Thanks.
Representative Riley.
Thank you. I'm Oakland County representative. I've been getting calls from our office for issues where people have not been able to get the vaccine that are clearly over 75 years old. They should be receiving it. These are the people that are calling the offices, so I started asking around some of the assisted living facilities, the nursing homes. One assisted living facility said nearly all their customers are over 75 years old. They have not been giving any date when they can receive these. They said possibly at the end of February. So obviously there's this shortage, and I received a call yesterday along with several of my other representatives from Oakland County who were offered to get the vaccine. So why would we, myself probably being the oldest out of the bunch, definitely not in the category that should be receiving vaccines, be approached with a vaccine? Why would the county be doing such a thing?
Do you have an answer, Director? An idea?
She got muted.
Sorry about that. I was muted. I do have an answer. That's a good question. We know across the state we have waiting lists for individuals who are waiting to get the vaccine, which I know is very frustrating for people, but I find very exciting, and I'm optimistic knowing that we have so many people who are ready to get vaccinated. I am unsure why we may have people reaching out to populations that are not inclusive of our priority populations, but we can certainly speak about that. One moment. Honey, I'm in a committee. I'm not doing it right now. No, go. I apologize.
No need to apologize. So I just want to touch on that. I think that's very problematic where you have a county that has I think I heard 400,000 people are looking to get it there in Oakland County, and yet the county health department is reaching out to local elected officials, letting them jump the line that are perfectly healthy. So when you allocate these vaccines, I know you guys have, you have your schedule you're going to follow. What requirements are there on the hospital systems, on the county health departments, that they actually have to follow that? And if they deviate, are there any punishments? Is there any punitive action taken against them?
The providers to whom we are sending vaccines to are aware of the priority populations that we are targeting. I could not speak to the actions that Oakland County is taking, but we certainly could discuss that after this so that I could learn more. But we certainly expect that our partners are following the priority population guidelines that have been laid out by both the CDC and the state of Michigan.
And if it comes to you that there's evident proof that they are not following it, is there any punishment for them, or are they, I mean, once they get it, are they pretty much clear to do whatever they want?
Well, our hope is that they're not doing whatever they want and they're following the priority populations. Getting people vaccinated, no matter who or where they are being vaccinated, is not a waste of a vaccine. Our preference and our priority is that we are focusing on those groups that are more vulnerable, and we work extensively with our partners to ensure that they have the resources and support that they need to be able to reach those groups. So again, I couldn't comment broadly on actions that I am unaware of being taken by some of these providers, but those would be some of the instances that we certainly will work through individually if necessary.
Okay. Yeah, I think that's got to be addressed at some point. I know you say it's not a waste of a vaccine, but if I get a vaccine as someone who's young-ish but fairly healthy, and that means someone who needs the vaccine and doesn't, and they pass away because of it, then it was a wasted vaccine. And I guess I am troubled in the sense that DHHS, the same department, has a number of orders out there, and there's punishments for people in the private sector if they don't follow those orders. So I guess I do have problems. I think maybe we will have to address this further at some point. And I know it's not you guys, it's Oakland County, but I think there should be some strings attached and maybe, you know, some punishment if they don't follow that. Representative Young.
Thank you, Mr. Chair. Thank you, Director. I just had maybe just one question. So you spoke a lot about making certain that the vaccine is available and you have to go and get it. So my concern is when you talk about those vulnerable populations and having access to transportation to go someplace, how are you addressing that?
That's a great question, and we talk about that a lot and are working with our partners to finalize and support the plans that they have in place to be able to bring the vaccine to people. We're currently working with the federal government through FEMA on 2 mobile units that we can deploy, some in rural areas, probably the UP to start with, and other areas where a lack of transportation is a barrier. And we will continue to develop and dedicate resources toward these initiatives that will allow us to reach people where they are instead of asking people to come to a central site to get vaccinated, because we do recognize that that is a significant barrier for a number of people across the state.
Representative Outman.
Thank you, Mr. Chair, and thank you, Director Hertel, for your presentation and testimony. My question is, the last I knew, there was no central database for hospitals to seek access to see if other independent healthcare workers have received a vaccination. Is this still the case? And if so, is there a plan to create some sort of database to do so?
All of our local health departments have lists of healthcare workers that would have fallen into the 1A priority category, and so there shouldn't be any problem identifying where those people and who they are.
Thank you.
Representative Wozniak.
Thank you, Mr. Chair. Pleasure to have you here, Director.
Thank you.
I appreciate the discussion on the social vulnerability index that you guys have developed. So I think there's a lot of moving parts there that some people might not understand, particularly in my area, Macomb County, Detroit area. There seems to be a real disparity between the distribution and that social vulnerability index, in that Macomb County has a time and a half the population of Detroit. We have more older people, but last week we only got 7,500 7,525 doses, where the city of Detroit got 15,000. Can you explain that? Was that a mistake in that social vulnerability index, or what happened?
Yes. The social vulnerability index, sorry, I've been doing a lot of talking, is something that is published by the CDC. It is not something that the state has developed. So I just want to make sure that, to be clear, this is a tool that is used across the country in determining social vulnerability. It does encompass 15 different elements based on race, housing, income, age. And so we know that the city of Detroit early on in the pandemic was ravaged by COVID-19. And that in the city of Detroit, we see health outcomes that are much lower than health outcomes across the state. And so in order to be able to vaccinate as many people as quickly within the city of Detroit, they did receive 15,000 doses in order to do that. That was just the beginning of a broader vulnerability strategy that we are going to be incorporating, which is to take a separate allocation outside of the allocation that providers will be getting and be able to distribute those in addition to other areas that have high vulnerabilities. So we are beginning to roll that process out.
That's the answer I was kind of seeking. And hopefully in the next couple of weeks, you can lower the tone of the rhetoric down in my area with regard to that disparity among distribution. Secondly, I haven't heard anybody talk about the possibility of anti-vaxxers making a big splash once we get through the vaccine period. That, of course, anti-vaxxers will say, no thanks, I don't want it. How are you going to handle that? Do you know yet?
We are working daily and extremely hard in ensuring that we are putting together accurate information and education for people to understand the safety of this vaccine and the importance, we believe, the importance of getting vaccinated, and are partnering with a number of different stakeholders across the state, from the business community, education, and our local health partners, to make sure that we are delivering that message to individuals everywhere. I can't make that decision for people, but our responsibility at the health department is to ensure that people have the most accurate information possible to be able to make an educated decision. And that's what we are striving to do.
Go slow, right? So one last issue. I'm an elder law attorney, and I've had many dealings with DHHS over the years. Most have been difficult in that I do a lot of Medicaid planning for elder people. And this is a little off topic, so you don't have to come up with a final answer on this. But what I found, and among the discussions in my elder law section group, the lawyers that handle most of those cases, is that DHHS becomes very uncompromising at times with regard to handling cases.
Representative, this committee is just for vaccines.
Yeah, I'm just making a comment, and I'm getting off. That's why one more time. So I just want to say I'm glad to have you here. Just tell your people to answer the damn phone.
All right, thank you for that. So I want to piggyback off of your first question, Rep. Wozniak. In talking to whether it's health providers, the counties, it seems that they tell us it feels very random how many doses they're going to get every week. And it's kind of sporadic and doesn't seem to make any sense. Things are always changing. I assume you guys have sort of this formula that you're using on how it's going to be distributed. How public is that formula? Can they actually look and see, like, all right, you're looking at population of healthcare workers in the county versus elderly population? I mean, is that public information that we can actually see what the formula is? Because right now, all we see is the number coming out, and we're told, well, we're looking at all these factors, but we're not told exactly how much each factor is weighted.
So we meet regularly, daily, with the local health departments We speak daily and have regular meetings about 3 times a week now with our hospital partners that are providing vaccines. And we went over in detail with both of those groups the allocation formula and solicited feedback and comments, which was extremely helpful to have them be part of that process. So we certainly could go over in detail the formula with you. I don't know if there is much value to putting something up on a website, because I think it does require some explanation as you go through the formulas to understand how they're weighted and what that means. But we certainly would be more than willing to have that conversation.
No, I think there's a lot of value in it being public. I would ask that you guys would post that, make it public. And a lot of people have asked questions about this social vulnerability index. It's kind of a new thing for me, at least. How much of a factor does that play into your formula?
Oh, off the top of my head, I don't know the weighting factor on that, but we are actually today, possibly even already, have posted additional information about the social vulnerability index on our website so that people can learn more about what that is and what it entails.
So I kind of started to look into this social vulnerability index, and there's things in there, in my mind, that don't really affect COVID, like the language someone speaks. If you don't speak English, you rate higher on this index. And so all things equal, county to county, if there's one county that has more people speaking English and another county has less people, more people speak non-English speakers, they're now going to be rated higher than the other county to get more vaccines through your formula. In my opinion, it doesn't matter what language you speak. That shouldn't determine the number of vaccines going to that place. It should be based off of health metrics, age, stuff like that, healthcare workers. But instead, someone's language is part of it. How does that make any sense?
That's a good question. It may seem that way, but what we know is that non-English speakers generally do not seek health care as often as native English speakers, which does result in seeing disparities in their health outcomes. So while on the surface, it may seem like that is not something that contributes to a person's health outcome, it absolutely does contribute to that. And we know that. We've seen those outcomes in the data over the past 40 years. So all of those elements do somehow have an effect on people's willingness or ability to be able to access the healthcare system, which does result in whether or not they are achieving good health outcomes or less than good health outcomes.
Yeah, I think there's a lot of factors more important than the language someone speaks. I would much rather look at, are they critical workers? Are they in the healthcare setting? What's their age? Do they have comorbidities? I think there's a whole host of issues more important than the language someone speaks. And I represent a district with one of the most diverse high schools out there, over 70 languages spoken in one of them. So we have a lot of foreign-speaking individuals in my district, and I think a lot of them would say the language that they speak has nothing to do with their health outcome. They would rather go to people that are sick. Representative Hoytinga.
Thank you, and thank you, Ms. Hertel, for being here and explaining all of this so well to us. I'm also trying to understand the social vulnerability part of it, because as I look at the map that was shown, I represent 3 counties just underneath Traverse City, and they all have a different color. So I believe one was baby blue and another was purple and then a darker purple. So I'm assuming those are the social vulnerability codes. But what I'm hearing is some of my people from Wexford County are now traveling down to the next county because they have available vaccinations. So now we have people traveling across lines to do this. And so when these places are reporting this, so if I have someone coming from Wexford County down to Mecosta County for a vaccination because it's more available down there, how are we reporting this? And then another question as far as the reporting, because I'm very into the data. Is there any lags in reporting time that we're seeing? Do we have any type of standardization that we're requiring these departments or these organizations to report their vaccination distributions within like X amount of days or hours? So I guess I have two questions in there.
Sure, I'll start with the second one. That's a good question on how we track vaccinations. We have the Michigan Care Improvement Registry in the state of Michigan, which is the tool that we use to track all vaccinations. Previously, it had been only for children's immunizations, but that has been expanded to cover all vaccinations in the state. So anytime you receive a vaccine, it is reported into our, what we call MICR, MCIR, our Care Improvement Registry. So that is our real-time tracker. It is also how we track what is in a provider's inventory to be administered. So we have that platform available to us, and obviously utilizing that for the COVID vaccination initiative as well. On the crossing county lines, I am a little embarrassed to admit that I do not have memorized all of the counties that are inclusive in each of our multi-county public health departments. So we do, our distributions are to local health departments, and a number of our local health departments are multi-county. So I don't know how they may be working among the counties within their jurisdictions, but we can certainly take a look at that and find out. That's a good question.
Thank you.
Representative Brixey.
Thank you, Mr. Chair, and thank you, Director Hertel, for the excellent presentation. Would it be possible for you to share that presentation with this group so that we can read all the information and have it to refer to? And my second question is, you know, I'm so happy to hear that the rollout has really improved over the last 3 weeks. And I'm wondering, you know, as your partners in the fight against COVID-19, what can we as community leaders do to help build confidence among the public in taking the vaccine?
I love that question. Thank you so much. We have a number of materials and I think ways to be involved for all of you to spread these messages and provide this education experience to your constituents. And we can certainly circle back around after this committee to make sure that people have access to the materials that we are using and being able to answer questions. Some of your colleagues are actually on the Protect Michigan Commission as well, and will be actively involved in helping to develop both the materials and the strategies for deployment. So as long as we can stay in communication, we can make sure that you have everything that you need to feel confident to speak to your constituents about the vaccine itself and the ways that people can access getting the vaccine. And absolutely on the presentation, we certainly will send that out to the committee.
Thank you very much.
So looking at the vaccine schedule that you have for who should get what, I know basically it's based off of age and based off of job, what that you do. And I'm talking to different people out there. I had a constituent of mine call me. He has an adult child that has Down syndrome. And according to him, those who have Downs are very susceptible to COVID. And so talking to him, he's saying, hey, I think it's like 10 times more susceptible. So his 35-year-old son doesn't really fall into these first couple categories, even though he's actually more susceptible than a lot of people that are now receiving them. I have friends that are teachers. They're my age. They're, posting on Facebook, hey, they got their vaccine. And part of me wonders, I'm glad that they have it, but should they have gotten it before someone who's actually more vulnerable? And then talking to people at the dialysis centers, they're saying they have a large population that's very, very susceptible to COVID. They're coming in 3 times a week. They've offered, I think they've talked to the department, they've offered to actually do the vaccines there so that they don't have to schedule another appointment. They're right there. They're susceptible. There's healthcare workers there that are able to do it, so they would feel comfortable with it. and they haven't got the go-ahead to do that yet. And so I just kind of wanted, what are your thoughts on maybe making this vaccine rollout plan a little more specific for people that do have those comorbidities, that are truly at risk if they do contract it? And furthermore, when there are agencies out there that already have a pretty good setup to go, I mean, I think the dialysis center, the patients are in there 3 times a week, so they're already there. Wouldn't that make a lot of sense to do that? So what's your thoughts on that?
Representative, if I had enough vaccines, I would send it to everybody and ask everybody to get it. Unfortunately, we are limited by the number of vaccines that we are getting, and we are following the guidelines that were established by the CDC on the priority groups for vaccination. So our focus first was healthcare workers. Second, we are looking at those 65 and up who we know have been particularly susceptible, as well as those frontline workers like teachers and childcare workers to ensure that we can maintain in-person schooling as much as possible, and that parents have a place to take their children if they are needing to go into work and are unable to work from home, or in some cases able to work from home but cannot do so with a child in the house, which I can understand. We have been talking to the dialysis centers. Yes, we've had that conversation and are starting to work through what the logistics of that would look like, and would love to be able to roll that out as soon as we are able to obtain the vaccine in order to do so. And I've also, I have heard from individuals as well on persons with disabilities as well as their caretakers, and they do remain a priority for me as we continue to work through the vaccination rollout schedule. So we're working to complete these priority phases that we're in, and then as we continue to get more vaccine into the state, we'll continue to focus on those groups that you, as you pointed out, continue to be vulnerable to the transmission of COVID.
Okay, and thank you. One final question. I know we have a few other people. We do have someone willing to testify after this. Are you willing to comment on your former director? Was he fired, leave voluntarily, mutual agreement? I mean, a lot of people are kind of wondering what happened there. Can you speak to that?
I'm sorry, I could not speak to that.
Okay, had to ask. All right, thank you for being here today. I appreciate the discussion. I know we have a lot of other questions we could get to, but we got to keep moving through the agenda. So next up is Jeff Elliott on Zoom. All right, if Jeff isn't there, then we have Roseanne, I think will be his stand-in. And this is with Cass County, Van Buren County Health Board. And just if you could kind of share your experiences working with the department on the vaccine rollout, some of the communication issues you've had, if you could share that with the committee, I would appreciate that. Thank you.
Well, thank you. Thank you for letting me speak to here today. I'm here at the request of my representative, Brad Paquette, and I'm a Cass County Commissioner, and I serve on the Cass Van Buren Health Board. I want to tell you what's happening in our little area of Michigan. We have over 19,000 residents who are 65 years of age and older, and they have signed up for the vaccine. And so far, less between the two counties than 1,200 have received the vaccine. And the reason for that is that we are not getting the vaccine in the amount that we need. Right now, if you look at the MDHHS website that's been on MI Live, Cass County, my county, is the lowest of the 83 counties. It's number 83 for those people being vaccinated. That's the reason why I'm here today, is to let you know that we are not getting the vaccine in any amount that we need. So whatever can be done so that we get this vaccine would be greatly appreciated.
Thank you. And I know obviously there's a shortage of vaccines from the federal level, so I know everyone's not getting as many as they would like, but your county is at the very bottom here, and I think that's very pertinent here. What has your communication to the department? I'm sure you guys have reached out to them saying, hey, you know, we are clearly way at the bottom here. What can we do to move our numbers up? Why are we so far down? What's your communication with the department been like?
With the Department of Health, oh, I'm on daily with them, sometimes hourly. They send me links when they do have a clinic, and I get those links out immediately. But when you only have 400 units of the vaccine, we can't get that many people vaccinated. I was on I had a meeting yesterday with some of our county partners, and they, of course, are saying the same things, and they are angry about it.
So you guys are ready, you are prepared. If the vaccines come to you, you have the capability to get them out there, correct?
Absolutely, absolutely. We've offered our ambulance service in our community. We've offered the fire station, which is enormous. It would be a great place to give out the vaccines. They're giving out the vaccines at Southwest Michigan College. And we have all kinds of people who have volunteered, retired nurses, all the ambulance services are ready and able and willing. So it's not that we can't do it. Logistically, it's that we don't have the vaccine.
Representative O'Malley has a question.
Well, more of just a backer up. Speaking with my health department yesterday, receiving 200 to 400 doses, it's just not that much. And just to her point, what I jotted down, the quote was, "We are working below capacity." They have volunteers, they have the people in place, they just need the vaccine. So I thought that was a good line, working below capacity.
It is very good.
Yep, no, I'm hearing that from a lot of people around the state. And I thank you for being here today. For the committee's knowledge, we did talk to a number of county health directors, hospital systems that shared a number of concerns, communication problems. And when we asked if they'd be willing to testify, a number of them said that they would not because they feared retribution from the department, that they would actually be denied more vaccines. And I'm hoping with a change in leadership at the department, hopefully that communication is starting to change. I think we've begun to see that, but that's something we want to look into and make sure that there isn't fear of speaking out that's going to be taken against you in the future. So with that, seeing no further business before the committee will stand adjourned.